Chandray Rheumatology and Immunology Center and Research, a center with a difference. Patient awareness talk by our experts in the field of rheumatology, clinical immunology, allergy and reproductive immunology.
Dr. Amla, working in Chandray Institute of Rheumatology and Research. So today I want to make you aware of something called chronic widespread pain syndrome. I'm pretty sure most of you may not be aware of this term called chronic widespread pain syndrome. Some of you might have heard the term fibromyalgia. Basically, these two are more or less, they come under the category of pain syndromes. One thing is chronic widespread pain syndrome will be the starting point, and while the extreme of this would be fibromyalgia. Let me introduce you to the term chronic widespread pain syndrome and what is the definition. I have made you in a simple language that you can understand actually. So basically the definition is it is a long-standing pain that lasts usually more than 3 months, and the pain will be usually in multiple body regions, and usually it will be a fleeting pain. Like if you have pain today in the neck, tomorrow it will be in the back, after 2 or 3 days it will be in your knee. Most of the times it is fleeting also, so it involves multiple body regions, and also there will be typically fatigue, you have concentration problems, and also some psychological problems like depression, anxiety, or a mixture of those things, and you are not able to concentrate on the work what you used to do before, and you may also feel the quality of life has changed after this chronic widespread pain has set in your life. Then actually the prevalence is said to be 10%, that is according to Western statistics, but in our country we don't have proper statistics saying what is the prevalence of chronic widespread pain syndrome. It may be more or less the same. So usually how these people will be they'll have the frequent consultations to multiple doctors, because every time they go to a doctor they'll get all the tests done, they'll examine you, they'll take the history and find nothing wrong about you. So actually so they'll go for another doctor to seek help. So they'll have that help seeking behavior from health professionals, so that in a hope that somebody will tell something you have and I'm ready to cure it. So now let me tell you usually what are the symptoms of chronic pain syndrome. So chronic pain syndrome takes a toll on both your physical and also mental health. Symptoms include joint pain, muscle aches, burning pain, numbness, fatigue, sleep problems, maybe sleep deprivation, excessive sleep, or lack of sound sleep, or you may be difficult getting sleep also, and you have loss of stamina and flexibility due to decreased activity, and also mood problems including depression, anxiety, irritability, or a mixture of many things. So who are more prone for this condition called chronic widespread pain syndrome? Let us see. Smoking. Yeah, smoking seems to actually plays a vital role in pathogenesis of most of the arthritis disorders what we see. And also these patients, the perception of pain is also different, and in those with arthritis, fibromyalgia and chronic pain disorders. And obesity, actually 50% of the obese people who come for the treatment of their obesity actually suffer from mild to severe pain, but that doesn't fit into any diagnosis of pain. Okay, so it is said that this obesity actually obesity will, in a complex way, that obesity will interact or interplay with body's hormones and metabolism. And age more than 65 years, actually as we age we are more fragile, and that is why the perception of pain will be different, so they'll end up in chronic widespread pain syndrome. And coming to depression, so one theory is that depression will change the way our brain receives the pain signals. So that will alter the way how the brain will receive the signals from pain fibers we have. So that is why mostly the threshold of pain is really less in those who are depressed. Maybe that is the cause for this chronic widespread pain syndrome being more common in people who are depressed. And chronic arthritis. So see, chronic arthritis actually will have that chronic pain, but most of the times what we see in our practice is, we see chronic arthritis patients, we treat them and reports everything will come back to normal, what we say as inflammatory parameters. So if those things get settled and there are no tender joints, usually we feel that the patient is in remission, but still the patient will have always the complaint of pain. So they are going into chronic widespread pain syndrome because of this chronic arthritis. Something which we have to deal differently other than treating chronic arthritis. Okay. So next, females. Actually, this thing is, females tend to have the more sensitivity to pain, and the threshold of pain is also really less. That may be due to hormonal differences or differences in the density of female and male nerve fibers. They are all theories. Nothing is proved as such. So diagnosis. Coming to diagnosis. So yeah. So you have pain for the last 3 to 6 months. Then you go to your doctor, right? So then how they diagnose actually chronic widespread pain, I'll just tell in simple terms so that you can make it. So you'll be asked things like when your pain started, what it feels like, whether it's a burning pain, sharp pain, dull pain or aching pain, where it's located exactly, and if anything makes it better or worse, like work, if you work a lot, whether it increases or decreases, or if anything makes it worse. So because certain conditions can lead to chronic pain syndrome, actually we want to order some imaging tests and also blood investigations to exclude all possible causes that really we can treat. What I mean to say is, see, even chronic arthritis, okay, rheumatoid arthritis you might have heard of, and some chronic back pain syndromes, all those things also present with chronic pain, but they are not necessarily chronic widespread pain, right? So what we want to do is, we want to essentially rule out all the things which we can really treat with medicines. So that is why we order so many tests when you come to us. So please kindly don't hesitate to get any tests done ordered by us, because we just don't want to miss out anything. Okay. So for example, we may order X-rays, MRIs, or a lot of blood tests we may order to rule out everything possible. And see, if everything comes out, if all the tests comes out to be negative and we don't find any direct cause of your pain, and also if you think that the pain is disproportionate to the trigger what you are seeing, then we may come to a conclusion that you may be suffering from chronic widespread pain syndrome. So that is the time when we want to treat you, right? So usually this chronic widespread pain syndrome, there are certain medications like painkillers or antidepressants or those things we give. So don't worry about the side effects of any medications. We don't usually give any medication without thinking of risk-benefit ratio. If the risk is really less compared to the benefit, then only we give you the drugs. Okay. So then coming to physiotherapy, like physiotherapy actually will increase the range of motion and also flexibility. So that helps you to come out of this chronic widespread pain. Okay. So regarding physiotherapy, coming Monday, we have a talk on exercise and physiotherapy and how it will influence in managing the pain. You can actually check on this coming Monday. Okay. And then nerve blocks. Usually nerve blocks is the last resort if it's really refractory. Otherwise, we won't go for now. Then coming to the main crux of therapies, psychological or behavioral therapy. So actually what they do, they'll have a positive effect on mood. There are so many types of psychological or behavioral therapy. That includes cognitive behavioral therapy. Cognitive behavioral therapy is basically a type of talk therapy that helps you to reframe negative thinking, and also it is shown to affect in boosting your mood. Okay. Then coming to biofeedback, this is something new. So this is a type of therapy which teaches you to use your mind to control bodily reactions. Actually, it's not new, it's pretty old thing. You might have heard of pranayama, all those things. It is a sort of the same thing what we do in biofeedback, and we train you how to do it exactly. Okay. Then coming to yoga, actually yoga will increase the flexibility and also it will increase the muscle strength. That is what actually is required for you to get out of this chronic widespread pain. Then coming to how, yeah, I have this chronic widespread pain, okay. So how to cope with it, how to live with it. So when you don't feel well, managing chronic pain can be difficult, and don't take much emotional stress that I have something, because that emotional stress can make pain even worse. I have some tips for you to cope with this chronic widespread pain. Okay, so one is focus on what is positive in your life, that is actually really necessary. Then you always get engaged in something. What I say you is, patients come to us saying, for the last 1 month I have lot of pains, because of which I am not going to my work, I'm not able to attend what regular routine I used to attend. Actually what we suggest them is, just go back to your routine, continue doing whatever you can, don't retreat yourself from your family or friends or activities you enjoy, or still able to do all those things and you are still not doing, then just go for it. Then participate in support groups. Actually in our country, support groups, actually we have to still work on it. If you can come to us, we can suggest you a few support groups which are there in our country. Then you can seek help, both psychological and physical, and there are compassionate health professionals out there, so we are here to help you out. Then ask for recommendations from family or friends, or local hospitals for referrals, because there are so many centers that are particularly dedicated to manage these chronic pain syndromes. So you can just ask for recommendations, come to us, we will help you out how much ever we can. Okay, thank you for giving your valuable time. And last but not the least, don't self-diagnose yourself as any syndrome, just come to us, we are here to help you out. Okay, thank you.